Hi, I'm Michele Campbell, and I'm going to go through Medicare 101 training, explain the basics of Medicare and what the costs are, when to enroll, how to enroll, and what your Medicare choices will be. So you see my contact information there. I am an independent agent, and that means I represent multiple companies, and I basically try to find the best solution to fit my clients' needs. All right, let's go ahead and get started. So original Medicare is only parts A and B. You see A, B, C, D, but just A and B are original Medicare. So A is your inpatient side, that's covering the hospital and some other benefits we'll go over in a second. And Part B is your outpatient side. So this is what your Medicare card looks like, and you'll see that you have A and B listed here. They list Part A as hospital and Part B as medical, but really the easiest way to remember is inpatient and outpatient. You could have the same date and you could have different dates. So just depends on when you enroll and what your situation is. So we'll go over that as we go through the presentation. This is your Medicare number. It's that unique 11-digit number that will be unique to you. So once you get that, you can enroll in a plan and you have A and B. So Part A, again, is your inpatient side. It covers inpatient hospital, skilled nursing, which is like rehab, hospice care, and some home health care, which is a visit from a nurse or therapist to come to your home and take care of, they come for like an hour or 40 minutes or something. It's not long-term care. Part B is your outpatient side. It's going to cover your doctor's visits, your any outpatient surgeries, whether it's at a hospital or a surgery center, any kind of lab work and testing from your basic x-rays to MRIs, medical equipment, medical supplies, preventative services, emergency services like, ambulance, emergency room, urgent care. Basically just, a lot of people say, well, is this covered or is that covered? Really, everything that you're insured with now, if you're on a group plan or individual, you have the same coverage with Medicare. It's just what does it cost me? And where is it like, is it covered under A or covered under B? So that's really the question. It's not, is it covered? Everything medically necessary is covered. So you don't have to worry about that. You're eligible at age 65 or older, or under 65 if you have a qualifying disability. So those that are diagnosed with end-stage renal disease or ALS, Lou Gehrig's disease, they go on Medicare automatically. You have to be a U.S. citizen or legal resident, and you have to have lived in the U.S. for 5 consecutive years just before applying for Medicare. Okay. Your spouse can, oh, that's the working quarter. Sorry, we'll go over that in the future. Okay, Medicare costs. So it's Part A is free as long as you worked 40 quarters, which equates to 10 years. If you didn't work 40 quarters, then you would have to pay for Part A, and you pay up to 278 or 506, depending on how many quarters you work. And when you apply Social Security, sorry, we'll advise you of that. This is where I was saying you could qualify based on your spouse's the amount of quarters they've worked. Okay, so as long as you were married at least for I believe 10 years, then they will qualify for you. Okay. Standard rate for Part B is 174.70. You could pay more. It's called the IRMA adjustment, Income Related Monthly Adjustment Amount. So IRMA is the acronym for that. That's where they increase Part B or D, and that's based on your income from 2 years ago. So let's look at what those numbers are. So for Part B, remember that's your outpatient side. They're going to, right now in 2024, they're looking back at your 2022 return, and they're looking at your adjusted gross income. So if you're single, then you're going to be over here in the individual tax return side. So if you make 103,000 or less, you pay 174.70. But if you make between 103 and 129,000, you're going to pay 244.60, and so on. Okay. If you're married filing a joint return, they give you, a little bit more, of course. So you see the amounts here. So you would pay the appropriate amount. If you're married filing a separate return, they kind of penalize you. So if you make over 103,000, then you are not, this is not great for you. So, you probably want to file a joint return if you can. Okay, so let's look at the D. So D is the drug plan. Um, so the Part D also gets adjusted. So it based on IRMA. So if you're just at the standard rate, you just pay your monthly premium. So if your premium is $20 a month, that's all you pay. But if you're in the next level, right, if you're at one of these income levels, they're going to add $12.90 to that $20. So you'd be $32.90. Okay. And this does adjust each year, every January, based on the new 2 years ago adjusted gross income. And you can appeal these numbers if you are no longer working, various reasons. That's something I can go over with you that's specific to your situation if this comes up. So you enroll through Social Security through, or you enroll for Medicare through Social Security. You can just go to ssa.gov and there's a Medicare tab at the top. And you're automatically enrolled in A and B if you're already collecting Social Security or Railroad Retirement Board benefits at age 65. Or if you're on disability and collecting SSI, they automatically enroll you at 24 months. So you would all of a sudden just get the card in the mail. Okay. And then they start deducting the Part B costs out of your Social Security income or your railroad income. So if you are working past 65, you can delay your Part B, or if you're covered under your spouse's coverage and you don't want to take it out yet, you can do that as long as it's employer group coverage. However, there's two little caveats to that. If your employer has less than 20 employees or your spouse's, you must sign up for Medicare. Okay, you must sign up for A and B. If it's over 20 employees, you can delay your Part B. They do want you to sign up for A and you can delay your B. So it doesn't matter if you sign up for A. However, if you are with a company over 20 employees and you're on an HSA plan, you cannot take out A and B because that's not considered a high deductible plan. And so you would get a penalty by the IRS at tax time because if you're funding the HSA, okay, if you're not funding it, it doesn't matter. But if you're funding it, it does. If you have any questions, you can always reach out and ask me after. I know it gets a little confusing, all these rules. The initial enrollment period is around your 65th birthday. It's a 7-month window. So if your birthday is this month, we're in March right now, then this you would be effective March 1st. Okay, everyone's effective the 1st of their birthday month, and if they're born on the 1st, they actually get an extra month. So if you're born March 1st, you would have been effective February 1st. So you could enroll anytime in December, January, or February for that March 1st effective date. Okay. So you can apply 3 months early, but the effective date is always going to be in your birthday month. And then you can continue to apply in your birthday month and then after. So if you've missed it, you have all the way till 3 months after. So this would be April, May, June, before you get any penalty. Okay. One question people ask, especially if they have a medical condition, well, am I gonna, are they gonna accept me? You're all guaranteed issue when you're turning 65, or if you're coming on when you're new to Part B. That's a guarantee issue, meaning they don't ask any medical questions. They accept everyone. They have to. So don't worry about any medical conditions. All right, so I just want you to be aware of some penalties. You do have 8 months to enroll in Part B. So if you're on an individual plan and you really like it, or you only have 8 months to pick up Part B if you want to stay in an individual plan. Most individual plans will tell you have to go off on Medicare. But once that 8-month window passes, you are now going to get a penalty. That penalty is 10% for every 12-month period you didn't enroll, and that is going to stick with you for the rest of your life. So if you qualify for certain circumstances, such as beneficiaries who qualify, you're a Medicare beneficiary, qualify for Medi-Cal or Part D extra help, they'll waive your penalty. Okay. If you're going on Cobra because you think, okay, my spouse isn't 65, I want to stay on for a while, and then I'll go on, Medicare in a year, you're going to get a penalty after 8 months if you didn't take out Part B. And just so beware of that. Um, it is creditable for the drug plan, but not for Part B. Cobra is. And by the way, if you're the employee and you are thinking that in your head, I want to stay on because I want to keep my spouse on, anybody can stay on. You don't have to stay on as the employee. You can just keep your spouse on and you can go off on Medicare. Okay. The drug plan, Part D, also has some penalties. So you have 3 months after your initial enrollment period, and then the penalty will take effect. Okay. However, if you are working and you have group coverage, you're fine. You won't get a penalty. But when you leave that active group coverage, you have 2 months afterwards um, to get a drug plan in place. And Cobra is considered creditable. So if you did take out Part Cobra, it would be okay for Part D. No penalties would incur. Okay, so just to go over some election periods. So we have our annual enrollment period every October 15th to December 7th. And this is where you can like switch plans, drop plans, change plans, whatever. So won't worry about the details of that right now, but oops, sorry, wrong way. But just know that's our annual enrollment. You'll get bombarded with literature at that time of year every year. Then we have a Medicare Advantage open enrollment period. That means if you're on an Advantage plan, I'll explain those in a minute. You can, and you were outside of open enrollment and you realize, I don't want to be on this plan, I don't like it, whatever. You can make one change during the first quarter, and that's it. During the annual enrollment period, you can make as many changes as you want. The last change you make before December 7th or by December 7th is the one that's going to stick, but only one change in that first quarter. And then we have special enrollment periods. The special enrollment period happens any time of year. The most common one is retiring, and you're now going to lose your group plan. That's where you have that 60-day window. Most of the special enrollments have a 60-day window, but some are a little bit more. If you move out of the service area or out of the state, the service area could be just moving over a county line. That could create a special enrollment for you. If you receive any kind of assistance in the form of Medi-Cal or extra help, that creates actually like a quarterly special enrollment. Diagnosed with certain diseases, there's certain plans you can go into, or disasters from natural causes. We've had a lot of those the last few years with fires and floods, and it's just been crazy storms. So yeah, it's been a little nutty across the country. Okay, so now you have your Medicare in place. It's time to choose an option for coverage. So you have two options. Basically, option one over here, you can do a Medicare supplement. That is like it supplements original Medicare. Okay. There are plan options within the supplement. You might have heard of Plan G or Plan F. Those are some options that F is in the past, but G is a current plan that a lot of people know about. And then the drug plan is a standalone drug plan. When you have a supplement, you have to add this plan. And this is through, insurance companies, and they range everywhere from 40 cents to, or actually some of them are even zero, up to, gosh, $160. It's all over the place. So we help you, guide you down this path of what the costs are and what plan to suggest for you and whatnot based on all kinds of determinations that we use or criteria. Medicare Advantage plans is your second option. If you do one or the other, not both. Medicare Advantage is also known as Part C, and it includes the drug plan. So it has the Part D built into it. And these are always, again, through private companies. There's many different options, and depends on what county you're in. But in the closer you are to cities, the more options you have, basically, because there's more medical groups. And again, it's very network driven. So we help people with determining which plan is going to work for you based on your doctor and what medical groups you're using. So let's talk about the difference. So Medicare supplement, you're typically going to have a little bit higher premiums. It's not that much higher, just a little bit. It's all less expensive than what you're thinking. It's way less than group plans and individual plans. You have lower out-of-pocket costs typically. Um, the plan pays for a lot of things. Between Medicare and the plan, you could have almost 100% coverage on certain plans, like a Plan G. So it's kind of a pay now versus Medicare Advantage typically has lower monthly premiums as low as zero, and then you pay deductibles and coinsurance and co-payments as you use the coverage. So this is kind of a pay later or pay as you go plan. Okay. Um, you can go to any doctor with the supplement. You can go to any doctor or hospital that accepts Medicare in the country. Like the network is huge. It's nationwide, right? Because Medicare is a federal plan. And Medicare Advantage, it uses a network of doctors. There's HMOs and PPOs. There's a lot more HMOs than PPOs, but they definitely use networks of doctors and hospitals, facilities, and whatnot. So you have to stay in the network. On HMOs, PPOs, you can go out, but the option to go out of the network is not as good. With the supplement, you have to add the drug plan. It's not included, so that is required that you add a Part D by Medicare, but it has its own cost. Over on the Advantage plan side, almost all the plans have drug coverage included. There's a few that don't, but most do. So again, just some things to consider. If you don't mind paying a little bit higher premiums, and they do go up as you age with the supplement. They don't with Advantage plans. This is giving you freedom to go to any hospital or doctor that takes Medicare. If you use multiple networks of doctors, you can, a lot of times you have to do a supplement because you can't go to necessarily two networks like in an HMO, right? An HMO just uses one network. Um, so let's see what else. Your maximum out of pocket is really low. It's really just very, very low on a supplement. Um, one of the cons is that you have to carry three cards. You have your Medicare card, your supplement card, and your Part D card. I don't think that's a big deal though, um, for the benefits that you're getting. On the Advantage plan side, you can keep your premium really low. If you never go to the doctor and you hardly use insurance, you could pay zero. And so you can, you have very little cost, just your Medicare costs, your Part B cost. If you don't mind using the network of providers, then this should work fine. Um, they also add a lot of extra benefits like dental, vision, hearing, fitness, over the counter, etc. Actually, a lot of those benefits are now added on to the supplements, so they're starting to get more competitive. And you just have one card. The thing with an Advantage plan, even though you're enrolled in Medicare, Medicare is sitting on the back burner. They're not paying your claims. Only the Advantage plan is. So you're like basically um, accepting them to be your only coverage. And you still have to pay your Part B premium to Medicare or to Social Security for your Medicare Part B. You have to have A and B in place in order to get an Advantage plan. And the cost is the same for everyone in the county, as I said earlier. Okay, so now we go into the Part D plan. So even though you might have a standalone drug plan or it could be built into the Advantage plan, it's going to operate exactly the same. It has the same structure to the plan because Medicare designs the structure. First of all, there's a formulary, which is a list of covered drugs. And so every formulary has to cover at least two drugs in every therapeutic category. So we know something's always going to be covered as long as there's a drug in that therapeutic category. And then the drugs are put into different tiers, right? They have tiers 1 through 6. Minimum, they have tiers 1 through 5. Some add a tier 6 and they put specific generic drugs, that maybe diabetic drugs or hypertension or something like that. But basically, your least expensive is going to be tier 1 and tier 6, and then it goes as they go up in price. The carriers can put them in the upper tiers. Typically, most people have tiers 1, 2, 3, and 6. or just one and two. A lot of generic drugs are in just tier one, even. So it's up to the carrier which tier they put that same drug in. So one company might put it in tier one might put it in tier two, and if there's 20 generic drugs, maybe they cover 10 of them, or another company, there's some overlap, but maybe, they don't cover the exact ones you take. And so we have a really sophisticated system, that software that we use, that we put your medications in, and then we run quotes that way. And it tells us what plan is best for you. There's also these rules that you have to follow for specific drugs. So there could be step therapy, which maybe the carrier is going to require you to try less expensive drugs for that particular drug you're taking. If you've already done that, they won't make you do it again. You can just have your doctor, um, or you tell them that you've done it already. There's quantity limits put on certain medications. A lot of times that's for safety. Prior authorization, they want to talk to your doctor first to find out why you're taking that medication. Or, sometimes maybe it's a risk factor. They want to make sure you're not taking something that, um, you know, reacts with it, things like that. Formulary exceptions are like if your drug is not on the formulary, um, you can request an exception. That's a really common thing in the Medicare world, and then they usually will cover it. There are preferred pharmacies and there are standard pharmacies. So we always ask what pharmacy you're using, and you want to try to stay with a preferred pharmacy because it's different prices at the different preferred or standard pharmacies. So you want to know who all your preferred pharmacies are. There's an insulin savings program. So specific insulins are $35, and there's no deductible and no coverage gap on those. So it saves people thousands of dollars. So again, our system knows that. And if you're taking those medications, typically it's going to call up a company that's giving you this, that's using this program or offering the program. So again, premiums, deductibles, formularies, they all vary between each company. Remember, there could be a late enrollment penalty if you never enrolled in a drug plan when you were eligible, and that's 1% of the national average for each month you didn't have it. So I use about 30 cents for every month you didn't have it, which adds up, if it's been some years, and that sticks with you for the rest of your life. And again, the drug costs change depending on which formularies and there's different stages also of the drug plan, which we'll go over. And so depending on which stage you're in, the costs change. And it's confusing, but we have to explain it to you. So let's start with the deductible. So each one of these, think of these like a bucket, right? You go from, when you fill this bucket up, then you go into the next one. So the first one's deductible. You pay up to $545 if there's a deductible on the plan. Not every plan has a deductible. Okay, then you hit the initial coverage where you start to pay a copay, which is a fixed dollar amount, or coinsurance, which is a percentage based on the drug's tier. Okay, so let's say you have an expensive drug. It's $500 a month. That's the retail cost, right? And you're paying $50 copay. Well, when the total cost, what you and the insurance company are paying for that drug, when it reaches 5,030, you enter the coverage gap, also known as the donut hole. So that's this next bucket. And now you're going to start paying 25% of the cost of all of your drugs, generic and brand name. So that $500 drug, you're now going to pay 25% of, 125. It'll be $125. And you'd pay that until the out-of-pocket costs reach 8,000. So the true out-of-pocket costs are not just your cost. It's also with the manufacturer. There's a manufacturing discount. There's what the insurance company's paying. And they've used what you've paid in these areas here. So I find my clients are out around $3,000, $3,500. And then they hit catastrophic. And when you're in this phase, you pay nothing for the rest of the year. Not everybody, most of my clients don't even hit the coverage gap. Some don't even reach the deductible. So it just depends on your medications and, the sum of everything you're taking. So that's what we help people with. And so don't worry about that. We will help you get the best deal. Okay. All right. So just to recap a little bit here, the only thing required to avoid any penalties is that you pick up A and B and you get a drug plan. This is not enough coverage because Medicare doesn't cover everything. When we say everything, it's not like 100% coverage. Okay. So you want to add either a supplement, okay, which will supplement A and B, and then of course the drug plan, or you do Medicare Advantage plan, which includes the drug plan, and and that would, either way, any route you go, then you'll be fine. You won't get any penalties. But we definitely recommend a supplement or an Advantage plan. So that's it. A lot of people ask, well, does it cost to use you? It does not cost you anything. We're not even allowed to charge you. So no cost. We get paid commission based on enrolling people in plans. So and then we're around to service you as you go. But um, we'll help find the right plan, simplify the whole process. I always get this afterwards from my clients. They're like, "Oh my gosh, I can't believe how easy you made this for us because we do your application, we take it all of the hard work out for you. You just give us all your information and we will suggest the right plan." I mean, it's a conversation. It's not just you give us and we tell you what the quote is. But it's a discussion that we have, and what we do after this is we'll do a Zoom call or a meeting in person with our clients, sit down for half an hour to an hour to determine, everything from your medication to your doctors and what's going to work for you and your budget, and get you enrolled. So, and we also guide people down that Medicare path, just getting enrolled in Medicare. So, feel free to reach out. We'd be happy to help you. And there's several agents in our office, so anyone can help you in our office. Okay, thanks so much. Have a great day.